Hello, everyone. A very good afternoon and greetings for the day. I'm Sayukta from All About Skin Wellbeing, and I'm sure all of you must be doing really good. We all know taking good care of our skin is important for more than just our appearance. As the largest organ, our skin becomes the most essential to our overall health. A fungal infection is quite common on our skin or nails, many a times on our scalp. Fungal infections are diseases caused by fungus, yeast, or mold. Mild fungal infection can look like a rash. It can be really itchy and annoying. So let's connect today with our skin expert, Dr. Tushar Jagtap, joining live from Mumbai to enlighten us on the topic of diagnosis and treatment of severe fungal infections. Dr. Tushar Jagtap is a dermatologist, he is specialist and counselor practicing in Bandra East, Mumbai. He is recently appointed as a convener of Healing Hands Unity Panel. He runs his own clinic called Dr. Tushar Zen Clinic, and he offers a wide range of dermatological services and products to cater to the varied requirements of his patients. He's highly skilled in his field and have received positive reviews from his patients on platforms like remedies, etc. He has years of experience in this field, and his skill and compassion have made a tremendous difference in his patient's life. It's so wonderful to have you with us, Dr. Tushar Jagtap. A very warm welcome to you, sir.
Thank you so much. Thank you so much.
Doctor, today we are going to talk about fungal infection. First of all, because we all know there are times when we see a lot of patients, a lot of people dealing with fungal infection, and it becomes so hard to tackle with it. As we know, we often say, especially in medical field, that prevention is always better than cure. So it would be appropriate if we start from here, how to prevent fungal infection at the first place.
I think that would be so nice. And at the outset, let me thank you and everyone on this platform. And we are on 8th of March. We have an International Women's Day. So I wish in advance to all the women of India and the world very happy International Women's Day.
Thank you.
And
Thank you.
I would like to begin with, skin is the largest organ of the body. So if anytime anybody asks you, especially in KBC show or otherwise, which is the largest organ of the body, then that is skin.
Okay.
So that is the one thing which you should remember. And before we start about the how does it, what are the preventive aspect, let me tell you something very interesting about about the zombie fungus. And what is this zombie fungus? Zombie fungus is also Ophiocordyceps unilateralis. The name of the fungus is Ophiocordyceps unilateralis. And what does it do? This fungus usually found in forest, especially in Africa. It has a power to kill the carpenter ants. And how does it do that? That's very interesting since we are talking about the fungal infection today.
Right.
This unilateralist, Cordyceps unilateralis, it infects the body of the carpenter ant, which is a big ant. And then what does it do? It's very interesting. After entering into the body, it slowly grows inside, and then it grows inside the brain, and there it starts making an ant to behave the way the fungus wants. So the
Right.
ant starts behaving differently, whimsically. Then what does the fungus do? They make the ant to climb the top of the tree, the base of the place where the fungus would grow in future, and the ant creates something known as a tight grip. Tight grip is a ant holds the leaves so tightly that it is unable, the mandible is locked, and the ant is unable to leave that particular leaf. And there the fungus grows inside, and eventually it kills the ants, and the spores are formed because this is how the nature works. It is a balance and the counterbalance in the nature which works. So colonies of ants are destroyed by this fungus, and so it is known as zombie fungus. It has a power to manipulate the behavior of the ant, and that's very interesting. So when we as doctors study or scientists we approach this thing, we have to give respect, understand the pathogen. And now fungus is neither plant and nor animal, but still
Right.
it has got tremendous power to infect the skin. And I will tell you what we commonly see here is superficial skin infections and deep skin infection. or systematic skin infection. And in superficial skin infection, as you rightly stated, that what are the precautions which we must take? Now, yesterday or day before, Mumbai was 40 degrees centigrade. So
Right.
we are into a thick of summer. The climate is going to be very hot and humid. And when the climate gets very hot and humid, the fungus, it's become a very good medium for the fungus or the moistness on the body, especially in the folds, intertriginal folds, to
Hmm.
grow. And so to prevent from getting a fungal infection, the first and foremost, if you could please take bath 2 times in a day.
Okay.
Wear such clothing, they are loose and preferably white in colors because white reflects the light. And so, if you wear clothes which are white in color, if you wear loose clothes, if you take two bath 2 times in a day, if you do regular exercise, if you wash your hands regularly, if you wash your clothes also preferably in a hot water, because this fungus has a tendency to remain, especially if you see it remains on the clothes also, it is on the soil also, it's on your back of the chair also, and it's everywhere, and it has a tendency to cross over from one person to another person by spores or molds. So what we have to do is that to prevent ourselves, there are 7 universal doctors we say that good, hydrate yourself properly, do exercise regularly, have a balanced diet, take a good sleep, don't think too much, exercise, and please take at least 10 to 15 minutes of sun exposure to get a good amount of vitamin D. Thank you so much.
And that story of that zombie fungus, I must say, was
Fungal.
very interesting, doctor. And that reminds me of another caterpillar fungus, which is quite common in the Himalayan terrain in India. In Hindi, we call it kira jari. So it's again a caterpillar fungus, quite similar
Okay.
to what you were telling
Zombie
us. So,
fungus.
yeah,
Zombie fungus. Correct.
fungus could be so potent. So that's
Hmm?
really interesting to know. Now, because as we are talking about superficial fungal infections of our skin, on our nails, on our scalp, and as you said, how important it is to maintain the personal hygiene things. Now, the thing is, doctor, as you said, folds. Folds are the common areas because proper ventilation, air, etc., is not there. Sweats, etc., get accumulated, and it makes it more prone to or a familiar. It gives a familiar environment for the fungus to grow. A very common problem in our society, I'm sure you will also agree to me, is that we normally ignore when something, irritates our skin. We will go for
Hmm.
home remedies, we'll go for DIYs because it's so much in trend these days due to these social media influences and all. We'll start applying something, or else we'll go and consult with a chemist
Yeah.
for any over-the-counter topical application before going to a doctor. I mean, normally in any country, people will first go and take appointment of a doctor. In our country, will first run inside our kitchen, try to apply something, nothing works out, go to a nearby chemist shop and
Correct.
start applying whatever they give us. The same, I'm sure, happens in the case of fungal infection as well.
Yeah.
Uh, how would you like to deal with the whole subject of DIYs, home remedies, or over the counter topical application? Do they really work or make the condition worse in case of fungal infection?
I'll tell you, this is very interesting topic question, and the topic which you have raised, and this is of vital importance. Our association, Indian Association of Dermatology, Venereology, and Leprology, we have been campaigning systematically for last 10 years because what medicines the chemist usually gives you, they are known as multi-drug combination. Sometimes there are five drugs inside one tube, and most of them contain steroids in that. What happens when those steroidal impregnated creams are applied for any infection, suppose say for fungal infection, the intensity of itching is going to go down, the morphology of fungus is going to go down, the severity of the fungus is going to go down. But what the patient does not understand that in long run, same steroid is acting as a fertile ground for the fungus to grow. And when these creams are applied, especially in our country, most of the times that OTC, over the counter prescription people take, or now because of the Google and the AI and social media, or going to the chemist, people buy medicines for themselves. I have come across recently a case, recently means day before, and she had applied some lotion, and because of the her lotion, because of that lotion, the skin got burnt. Remember that the superficial fungal infection is a keratophilic infection. Keratophilic means it digests the keratin, which is there in the hair, nail, and the skin, and it is not more than 1 to 2 millimeter in depth, but it causes intense problem, especially it is in such intertriginous areas, or sometimes you see it on the exposed parts also of the body. So what is to be done, that please avoid, please avoid all these medicines which you take over the counter, which may in short run gives you some benefit, some relief from the symptoms, but in long run it causes lots and lots and lots of problems. Steroid is to be used when it is necessary, when it is must, and 100% under medical supervision, because that is a one molecule which is such a great molecule. Please dispel the fear from your mind. But if you use it unintentionally, unwanted, and for a prolonged period of time, it does create lots of problems. So many patients have gone. As soon as we see the patient, we know that this patient must have applied lots of steroidal cream, multi drug combinations creams, and he or she has a lot of problems. And then they take time to recover. The problem is
Right.
that शॉर्टकट मेजर्स शॉर्टकट्स में जो काम करते हैं उसका फिर नुकसान उनको भुगतना पड़ता है. सो कृपया मैं आपसे हाथ जोड़ के विनती करता हूँ, जो सब ये देख रहे हैं, कि आप आपके डॉक्टर की सलाह से ही दवा करिए. धन्यवाद.
बहुत अच्छी बात डॉक्टर आपने कही। कई बार हमें लगता है कि हम एक डॉक्टर की कंसल्टेशन फीस बचा लेते हैं ओवर द काउंटर एक क्रीम लेकर, लेकिन लंबे इस्तेमाल के बाद, जैसा कि डॉक्टर जगताप ने बताया, वो प्रॉब्लम सुपरफिशियली हमें लगता है ठीक हो गई, लेकिन अंदर ही अंदर वो बहुत गहरी हो जाती है। डॉक्टर के पास हमें अल्टीमेटली जाना पड़ता है, लेकिन तब तक जो काम बहुत आसानी से अगर हम पहले डॉक्टर के पास चले जाते ठीक हो जाती, उसमें ज्यादा वक्त लगता है। सो डोंट कॉम्प्लिकेट योर प्रॉब्लम, go to the correct person at the correct time. As soon as you start experiencing that something is not normal on your skin, please go and consult a qualified dermatologist. So don't waste your time, energy, money, and most importantly your health. Doctor, another very common issue that we are facing, especially in case of fungal infections, is that recurrence or resistance.
Hmm.
So, would you like to shed some light over that recurrence of fungal infection, resistance with fungal
Very
medicines?
much. Very much, very much. I would tell you that this is a very chronic problem. For last 20 years, we have been, facing this fungal infection. Luckily, this year and last year, the incidence has gone down. But I had cases where the patient, because of the frustration, because of the recurrence, because he or she is not getting all right, they have tried so many things. And I would not like to narrate that one particular case where this boy was so disturbed, so distracted, and he was a computer savvy boy, and he tried to harm himself. And when he came to me, I did counseling. I told him the resistance you get because there is one important thing. What we have to see is whether उनको शक्कर की बीमारी है या डायबिटीज की बीमारी है कि नहीं. डायबिटीज इतना कॉमन है कि मेरे प्रैक्टिस के अंदर मैं जब भी रैंडम ब्लड शुगर मीन्स पेशेंट बहुत कहते हैं कि हमको शुगर नहीं है, हमको मालूम नहीं शुगर है कि नहीं, हम ना दवा कर रहे हैं, और जब मैं उनकी रैंडम ब्लड टेस्ट करता हूँ ब्लड शुगर की, तो 1/3 पेशेंट जिनको स्किन की बीमारियां है, खास करके फंगल इन्फेक्शन है, उनके अंदर डायबिटीज निकलती है. तो अगर आपको डायबिटीज की शिकायत है, आपको इम्यूनो कॉम्प्रोमाइज है फॉर सम और अदर रीजन, और आप कुछ बड़ी ट्रीटमेंट कर रही है, और सबसे तो ज्यादा मैं आपको कहूंगा कि सबसे बड़ी प्रॉब्लम आज हम खास करके सिटीज में देख रहे हैं, तनाव, स्ट्रेस, फियर, एंजाइटी, नर्वसनेस इतने कॉमन है कि जिसके वजह से अंदरूनी ताकत कमजोर हो जाती है. एंड ओवर थिंकिंग से आज सब लोग परेशान है. मैं इस प्लेटफॉर्म से सबको बताना चाहता हूँ कि आज बाकी चीजों बाजू में रखो, ये 5 चीजें जो है, फियर है, नर्वसनेस है, एंजाइटी है, ओवर थिंकिंग है, और ये जो 5 चीजें हैं, इन 5 चीजों से आपको बचना है. और इससे आपको फंगल इन्फेक्शन बहुत ज्यादा होता है। समझ लीजिए, जब भी आपको कुछ भी इन्फेक्शन होता है बॉडी में, कुछ भी स्किन के ऊपर होता है, ये
हम्म,
बॉडी का आपको संदेश है कि आपको रिलैक्स होना चाहिए, आपको स्लो डाउन करना चाहिए, आपको आपके तरफ ध्यान देना चाहिए। यू हैव टू वर्क ऑन योर सेल्फ, एंड वंस यू डू दैट, फंगल इन्फेक्शन कम होते हैं। एक तो डायबिटीज है, इम्प्रॉपर ट्रीटमेंट। बहुत सारे पेशेंट्स क्या है, शॉर्ट कोर्स लेते हैं, थोड़ा ठीक लगा, दवा बंद कर देते हैं, फिर रिकरेंस हो जाता है। कभी कभी कुछ टाइप ऑफ फंगस ऐसे। और यहाँ एक बात मैं कहना चाहूंगा, वन थिंग आई वांट टू मेक इट वेरी, यू नो, आप हमारे ब्लड ग्रुप्स है ए बी एंड ओ। अभी इसमें ऐसा पाया गया है कि जिनका ब्लड ग्रुप ए है, उनके अंदर क्रोनिक फंगल इन्फेक्शन होने की समस्या ज्यादा है। या
अच्छा।
जिनके कुछ जेनेटिक जेनेटिक प्रीडिस्पोजिशन है उनके अंदर ठीक। तो डॉक्टर्स ने ध्यान देना चाहिए कि इस पेशेंट का ब्लड ग्रुप क्या है, इनकी फैमिली हिस्ट्री क्या है, इस पेशेंट्स के डाइटरी हैबिट्स क्या है, बिकॉज ऑल दीज थिंग्स मैटर्स व्हेन यू सी अ क्रॉनिक रिपीटेटिव फंगल इन्फेक्शन, व्हाट सॉर्ट ऑफ मेडिसिन इज टेकिंग। जैसे आपने कहा पहले कि बहुत सारे पेशेंट्स आयुर्वेदिक हो, होम्योपैथिक हो, या सेट मेडिकेशन हो, या ओटीसी ट्रीटमेंट हो, ऐसे बहुत सारे कुछ कुछ नुस्खे या दवा लेके आते हैं, और जिससे काफी नुकसान होता है। और इसके वजह से जो रिपीटेशन है, जो क्रॉनिसिटी है एंड रिपीटेड इन्फेक्शंस है, उसकी संख्या या उसके उसके परसेंटेज बढ़ जाते हैं। To avoid that, you have to be aware about your infection and please consult a good dermatologist and take treatment according to his according to his schedule, the prescription which he or she gives. Thank you so much.
राइट। तो सबसे पहले तो अगर फंगल इन्फेक्शन है, भले ही एज अ लेमन आपको नहीं पता है कि फंगल इन्फेक्शन है या नहीं, तो भी कुछ भी अगर स्किन में एबनॉर्मल है, रैशेस है, इचिंग हो रही है, तो प्लीज एक क्वालिफाइड डर्मेटोलॉजिस्ट को दिखाइए और इलाज पूरा लीजिए, अपने डॉक्टर पे ट्रस्ट कीजिए। ये भी बहुत जरूरी है। जैसा कि डॉक्टर ने कहा, एक बहुत आम टेंडेंसी हम लोगों के बीच में होती है, थोड़ा सा आराम मिल गया, हमें लगता है अरे हो गया, दवाइयाँ हम लेना बंद कर देते हैं, डॉक्टर को भी इन्फॉर्म नहीं करते। फिर से सिम्टम्स दिखते हैं तो चूंकि हमारे पास प्रेस्क्रिप्शन है, हम खुद ही दवाइयां ले आते हैं और फिर से
Hmm.
अपना ट्रीटमेंट चालू कर देते हैं। ये सही तरीका नहीं है। ये एक बड़ा रीजन है, एक बड़ी वजह है जिसके चलते बार बार फंगल इन्फेक्शन होता है, रिकरेंस होता है। तो इससे अगर बचना है तो सबसे पहले अच्छे से फंगल इन्फेक्शन का ट्रीटमेंट करवाइए, ये बहुत जरूरी है। डॉक्टर, हमने काफी हद तक ये बातें की कि क्या नहीं करना चाहिए, होम रेमेडी, DIY, ओवर द काउंटर टॉपिकल एप्लीकेशन नहीं करना है, बीच में मेडिकेशन नहीं बंद करना है, खुद से डॉक्टर से हमेशा संपर्क में रहना है, ये सब बातें हमने की। अब क्या करना चाहिए अगर मान लीजिए एक व्यक्ति है जिसे बार बार रैशेस हो रहे हैं, इचिंग हो रही है, उसे नहीं समझ में आ रहा है कि ये क्या है, तो वो क्या करे?
बहुत अच्छा सवाल है आपका कि अगर किसी को बार बार शिकायत होती है या उनको लगता है कि मुझे फंगल इन्फेक्शन हो गया है, तो क्या करना चाहिए, तो डॉक्टर की सलाह लेनी चाहिए। लेकिन आपके तौर पर क्या कर सकते हैं, तो लूज क्लोथिंग। मैं आपको बता रहा हूँ कि मैं पेशेंट को हाथ जोड़ के विनती करता हूँ कि खास करके जिनको स्किन की प्रॉब्लम है, खास करके ग्रॉइन एरिया में, तो आप अंदरूनी कपड़े मत डालो। एंड दे गेट शॉक, दे गेट, अरे आप ऐसा कैसे कर सकते हैं। मैंने कहा कि देखिए, अगर आपके पूरी बॉडी वेंटिलेटेड रहेगी, तो आपको एयर के अंदर जो ऑक्सीजन है, दैट्स वेरी मच इंपॉर्टेंट व्हेन यू इफ यू वांट टू गेट रीड ऑफ इन्फेक्शन। और जो मॉइस्टनेस आता है, वो मॉइस्टनेस चला जाता है, मॉइस्टनेस चला जाने से फंगस कैन डाई एंड द बॉडी विल गेट अ चांस टू टेक ओवर द फंगस। सो ये हमको करना चाहिए, लूज क्लोथिंग डालनी चाहिए, बैलेंस्ड एंड ग्रीन लीफी वेजिटेबल फ्रूट्स लेने चाहिए, एक्सरसाइज करना चाहिए। मैं आपको दावे के साथ कहता हूं, जो लोग रेगुलरली एक्सरसाइज करते हैं, उनके अंदर फंगल इन्फेक्शन की जो स्टैटिस्टिक्स है, वो लेस देन 5% है। Fungal
अमेजिंग।
infection, because exercise not only helps you to build your body, exercise helps you to create your positive immune system. It increases your concentration, it increases your emotional health, and it gives you lots of confidence. The moment you have physical, mental, emotional confidence in you, the moment you are level headed, you are good at health, and you are rocking in life, believe me, fungal infection will not catch you. So what you have to do, you have to be happy, you have to do exercise, you have to eat balanced diet, you have to do good sleep, And again, I will say not to overthink or catastrophize. Thank you.
Right. And doctor, when a patient comes to you with fungal infection, are there normally any tests that you recommend for proper diagnosis, or just by physical investigation you're sure of it?
Oh no, I'll tell you, fungal infection is quite dicey. It's not that easy to diagnose, and in our country people are quite shy to show their intimate parts. But I would say that when the doctor insists, one must do that. I have seen number of cases patient had already taken blindly for fungal infection from even doctors who did not wanted to check, and maybe the patient feels shy, but when you see it was not fungal infection, it was something else. The fungal infection can mimic pityriasis rosea. Fungal infection can mimic other skin conditions, other rashes, other immunological or dermatological problems. So please, when the taste, you say the best taste, and for that I will request, I will take this platform that every doctor, every dermatologist must have a microscope in his clinic. Why I'm saying must have microscope in his clinic? Because you just do the scraping either from the scalp or from the nails or from the skin part wherever there is a fungal infection. उसको scrape करिए और हमारा पोटेशियम हाइड्रोक्साइड KOH का 15-20% का उसका एक ड्रॉप लीजिए, उसमें इस स्क्रेपिंग को रखिए, ऊपर से आप स्लाइड रहती है, ऊपर से वो छोटे सी जो प्लेट्स आती है कांच की, उसको लगाइए और माइक्रोस्कोप के नीचे देखिए. You would be able to see spores, molds, and you will be able to diagnose fungal infection in no time. It takes 15 minutes. So
Right.
KOH mounting, that is a test which is known as. Even saline test is there. Instead of KOH, you can use saline and see under the microscope. That can be seen. If you want to go further, there are many tests which can be done. Biopsy, but not very remotely. Very rarely we do that. Some blood cultures can be done. Fungal culture can be done. We have some antigen antibody tests. Those tests can be done. And if there is a systematic infection, if systematic involvement is there, then we do ask for X-ray, we do ask for MRI, we do ask for CT, and sometimes we do ask for DNA sequencing in fungal infection. So these are the various investigations which could be done if you are not sure of the diagnosis, or if you want to confirm the diagnosis and before starting the treatment or during the treatment. Thank you.
Right. And doctor, what are the treatment options available?
See, then we have to differentiate between the superficial fungal infection that is known as dermatophytes or tinea, commonly called as tinea. So you have tinea of scalp also that we call as tinea capitis, the beard area, tinea barbi. If you're in the body, we call it as tinea corporis. In the groin, we call it tinea cruris. And if it is in the web spaces of the toes, then we call it athlete's foot, which is very common. Correct.
Mhm.
So depending on the site, there is the infection, severity of the infection, especially itching is very common in fungal infection. Then irritation is very, and actually itching is more pronounced in the night time. So the treatment is to alleviate the symptom. If the itching is too severe, you can give him antihistaminics as per his needs, sedating and non-sedating type. Antihistaminics दे सकते हैं आप. एंटी फंगल मेडिसिन दे सकते हैं. एंटी फंगल्स में काफी एजॉल्स करके है, देन पॉलियंस करके है. तो ऐसे चार अलग अलग ग्रुप्स की दवा रहती है, और इस चार ग्रुप्स की जो भी दवा है, खास करके उसमें एजॉल्स है, जिसमें फ्लुकानाजोल आता है, कीटाकोनाजोल आता है, इप्राकोनाजोल आता है ओरली. तो उससे एंड इवन लोकली दे गिव्स अ वेरी गुड रिजल्ट. देयर सेफ्टी प्रोफाइल इज गुड. Especially, only one thing about ketoconazole is that you have to do G6PD test, and you have to see whether the patient is allergic to it or not. But local application is quite safe. You get good results. ग्रिजियोफोल्विन इज वन मेडिसिन. अभी क्या हुआ था कि ग्रिजियोफोल्विन जो पहला मेनस्टे ऑफ एंटी फंगल थेरेपी था, उसको लोगों ने नए ड्रग्स आने के बाद ग्रिजियोफोल्विन का इस्तेमाल कम हुआ. अभी नए ड्रग्स को रेजिस्टेंस आ रही है. बहुत सारे जो इट्राकोनाजोल है उसको रिस्पांस अभी पहले जैसा नहीं आता. तो आई हैव स्टार्टेड यूजिंग ग्रिजियोफोल्विन बैक इन माय प्रैक्टिस, एंड आई कैन टेल यू ग्रिजियोफोल्विन एक ऐसा मॉलिक्यूल है जो बच्चों में भी दे सकते हैं. इट्स क्वाइट सेफ आफ्टर इन द किड्स, and it can be given in the adults also, and it gives fantastic results in all the tinea infections of the body, and whether it is hair, nail, or skin. So griseofil is a molecule, terbinafine is a molecule, itraconazole is there, fluconazole is there, voriconazole is, ketoconazole is there, and there are newer molecules also which are in the pipeline. they can be used. And in systematic fungal infection, there are other drugs like amphotericin B which can be used depending on what kind of an infection it is, what is the severity of the infection. So in between, you must have heard about mucormycosis, which used to cause blindness. और उसका हमारे देश में काफी संख्या बढ़ गई थी म्यूकोरमाइकोसिस के केसेस में। तो वहाँ ये जो सिस्टमैटिक एंटी फंगल एजेंट्स है वो देते हैं जिससे फायदा होता है। थैंक यू, धन्यवाद।
राइट। now डॉक्टर टॉकिंग अबाउट नेल फंगल इन्फेक्शन, वो कौन है जिन्हें ज्यादा रिस्क होता है नेल फंगल इन्फेक्शन का, और उसमें लगभग कितना टाइम लगता है, क्योंकि हमने सुना है कि स्किन के फंगल इन्फेक्शन के ट्रीटमेंट के मुकाबले नेल का जो फंगल इन्फेक्शन का ट्रीटमेंट है उसमें ज्यादा वक्त लगता है।
बिल्कुल, अभी नेल्स का कैसा है कि जिनका कांटेक्ट ज्यादा से ज्यादा नेल्स में, खास करके हमारे माता भगिनी जो काम करते हैं उनके
हम्म।
यहाँ, उनके अंदर हो सकता है। फिर जो वेटर्स रहते हैं होटल्स के अंदर उनके यहाँ हो सकता है। जिनका भी जो भी घरेलू महिला का कामगार है जो काम करते हैं उनके यहाँ भी फंगल इन्फेक्शन, बिकॉज देयर इज टू मच ऑफ देयर फिंगर्स आर immersed in water for a long
राइट।
period of time. Plus, most of the time they don't look after their health as far as their diet is concerned, their well-being is concerned. They are busy around the clock looking after children, looking after family chores, and so and so so and so. So उनके अंदर ये चीजें nail infection ज्यादा होता है, और because the nails are most of the time moist. और नेल्स का कैसा है कि इनके अंदर ये जो भी इंफेक्शन होता है डर्माटोफाइटोसिस हम कहते हैं, तो उससे उसमें नेल डैमेज होते हैं, नेल पीले दिखते हैं, खराब दिखते हैं। और इसमें एक है कि सोरियासिस में भी नेल चेंजेस होते हैं और टीनिया इन्फेक्शन में भी नेल चेंजेस होते हैं। तो उनको डिफरेंशिएट करना बहुत जरूरी है, और उसको डिफरेंशिएट करने के बाद आपको ट्रीटमेंट देनी पड़ती है, बिकॉज नेल इज अ क्यूटिकल, इट्स अ वेरी हार्ड स्ट्रक्चर। So for the medicine to act, it takes lot of time. So medicines के लिए आपको काफी हद तक दवा लेनी पड़ती है, और साथ में आप काफी अच्छे माइक्रो न्यूट्रिएंट्स, एंटीऑक्सीडेंट्स को लीजिए। विटामिन सी इज वन ऑफ द बेस्ट एंटीऑक्सीडेंट which you must take as a co-prescription. Where then there are so many other multivitamins which you can take with a medical advice. So I feel that nail infection is commonly seen in people whose hands are most of the and those who have some internal diseases, problems like say diabetes, they have malabsorption syndrome, or their immunity is not good for some or other reason, or they are undertaking some treatment for the malignancy, or immunocompromised host, maybe because of there are so many infection previously. Luckily now that infection is on the wane, but we had this human immunodeficiency virus HIV infections, and in those infections fungal infection had flourished. So we have to be very careful as far as the fungus is concerned. You have to take care of yourself. You have to take care of your body, mind, and spirit. So to stay healthy and get over this infection fast. Thank you.
And similarly, doctor, would you like to shed some light over scalp related fungal infection?
What? Please come again. Please.
The fungal infection of scalp, would you like to shed some light over
Yes, yes,
that?
yes. Yeah, yeah, yeah. Scalp is one of the hair follicle is one of the very important because it also contains keratin, and the fungus has got affinity for it's a keratophilic. Keratophilic means it loves keratin. It survives on keratin. It eats keratin. So hair is made up of keratin, which is a protein. So if you get a fungal infection of the hair, especially it is seen in children also, it is known as tinea capitis. And tinea capitis, you may lose hair there. Okay. And sometimes something happens that is known as carrion. And carrion, you get a boggy swelling on the scalp. And one has to differentiate between carrion and another bacterial infection or other infection because it is quite painful. It's an immunological reaction. And then you have to understand that it is carrion and then give a proper treatment because it is painful. And most of the time it is misdiagnosed. So for hair for the hair for the condition of hair affected by fungal infection, the doctor has to be very careful to understand what it is and then prescribe the right dose and right advice to the patient so that the recurrence would not be there. Thank
Right. Now, doctor, coming back to our main topic, the superficial skin related fungal infection or any kind of fungal infection, which is on skin, scalp, or nail, What should the family members do in case there is a patient? First is definitely to make them go and check for the doctor, get the treatment started, is of course an important step. But otherwise, because in our societies and our homes and our families, we have this tendency of sharing many things, like starting from pillow covers to towels to bed sheets, etc. Is it a big risk, because we know that fungal infection can get spread from one to another?
It's very common. We see that fungal infection, and before fungal infection, I would say the most contagious disease is scabies. So fungal infection comes after that, and when somebody in the family is suffering from the fungal infection, he or she has to take absolute care that wash all your clothes in hot water, dry them properly. Your bed sheets, your linens, and all those commonly used goods, they have to be taken care of immediately. Other family members has to they can take precautions that not to share the same towel or not to share the same clothes. And I would say that of course going to the doctor is important, but the family member should give love, care, and concern to the patient. Don't
Right.
underestimate fungal infection. Fungal infection is directly related to your ecosystem. Thank you.
Okay, I'll take a few questions from our viewers. So there is Purvi Mehra. Question is, can I use soap on fungal infection?
Yes, you can. You can use, and there are many soaps which has got antifungal properties in that, which have ketoconazole in it or other antifungal molecule. And so, yes, you can use. There is no harm using soap on your fungal infection affected part also. Thank you. Parts also. Thank
Lucky Sharma is here. His question is, can fungal infections on the skin be treated with oils?
you. With oils, unlikely. ऑयल से नहीं ज्यादा फायदा होता है। हमारे यहाँ लोग बहुत सारे केराटोलाइटिक एजेंट्स लगाते हैं, जैसे और जिसका काफी नुकसान होता है। अगर आप आपकी अंदरूनी ताकत बढ़ाते हैं, इफ यू आर लिविंग अ वेरी बैलेंस, हैप्पी एंड रॉकिंग लाइफ और वेरी हैपनिंग लाइफ एंड यू आर फीलिंग वेरी कॉन्फिडेंट, यस, not necessarily you have to apply the creams all the times. If your internal immunity takes over, that is how the fungal infection is cured. If it is
Right.
internal immunity takes over, you can get all right with oils also. But ideally, you have to use an antifungal cream. Thank you.
राइट। कई बार होता है डॉक्टर, स्कैल्प फंगल इन्फेक्शन की अगर हम बात करें, लोगों को लगता है कि ये डैंड्रफ है या ड्राई स्किन है। और अगेन हमारे सोसाइटी में स्कैल्प की ऑयलिंग, या खास तौर पे अगर डैंड्रफ है या फंगल इन्फेक्शन भी हो, हमें पता ना हो, तो हम ऑयलिंग स्कैल्प पे करना काफी पसंद करते हैं, उसे घंटों तक अपने सर पे रखना पसंद करते हैं, और हमें लगता है इट वर्क्स। बट कई बार डॉक्टर्स ये भी कहते हैं कि अगर वो फंगल इन्फेक्शन है, तो वो फंगस को एक बहुत अच्छा एनवायरनमेंट दे रहा है वो ऑयल ग्रो करने के लिए। सो व्हाट्स योर टेक ऑन दैट?
आई वुड से कि डैंड्रफ जो है वो डिफरेंट एंटिटी, उसको हम लोग पिट्रियासिस सिक्का कहते हैं, जिसके अंदर एलर्जिक ओरिजिन होता है। द स्किन प्रोलिफरेट्स एट फास्टर स्पीड, बट वहां एक पिट्रोस्पोरम ओवाल नाम का फंगस भी होता है उसके अंदर। तो
ओके।
उसके लिए अगर आपको डैंड्रफ है तो बेस्ट इज टू यूज अ शैम्पू, स्पेशली विच हैज गॉट सेलेनियम सल्फाइड इन इट or which has
राइट।
got ketoconazole in it, and those shampoos help to get rid of that. Applying oil for a prolonged period of time and the fungus would grow, I don't think it is related. In our country, oil application helps in, especially for hair growth. And
राइट।
I would not say that if you are, unless you have a very severe infection, but oil application per se would not cause increase in fungal infection on the scalp. Thank you.
Okay, doctor. Dr. Jagtap, before we wind up the whole session, anything that you would like to repeat, or anything that we have missed out on that you would like to say before we conclude the session?
Oh, I know. I would say that fungal infection is very important. Fungal infection or any infection in your body or on your skin, it is body is trying to tell you something. Please understand that body is trying to tell you something. You are not paying attention to your body. You are not paying attention to yourself. So in that case, whosoever gets whatsoever infection, first please reflect What is happening in your life? What are you doing? Are you spending some time with yourself? Are you spending some time about yourself? So I would say, okay, I will request all those who are on this platform listening to this Facebook live that any infection, and if you want to cure the infections, stop, pause for a moment, try and understand you have some infection. Please go to a right dermatologist, right doctor, and please take the treatment according to his or her advice. Doubts and doubts are a very important aspect of our life. Please don't carry doubts when they are necessary, yes, but otherwise what has happened, people have become very anxious. So becoming anxious as far as taking treatment is concerned, please don't do that. Please, please let us respect every specialty. Let us respect every expert of various fields, different fields. Let us not generalize things. I think that is what I could, have my two sides for this. Thank you so much.
Thank you, Doctor. It was wonderful talking to you. Thank you for your valuable time and making this session so informative and practical. Thank you so very much, Doctor, once
Thank
again.
you. Thank you.
And viewers, thank you for your excellent participation. For more information and updates on skin health and care, stay connected on our FB page all about skin well-being. We are also available on YouTube, Twitter, and Instagram. Thank you and have a great day ahead. Goodbye.